Vulnerable patients are being left stranded, and before another tragedy happens, we need answers. I am reaching out because I believe there is a growing public safety crisis involving non-emergency medical transportation, NEMT, providers serving Arizona's most vulnerable residents. I live with multiple sclerosis and depend on transportation services because my disability prevents me from driving. Unfortunately, I have personally been left stranded on the side of a busy highway in a disabled vehicle outside medical offices for as long as 7.5 hours, and most recently for 2 hours in temperatures exceeding 100 degrees. My story is not unique. Every day, seniors, people with disabilities, dialysis patients, cancer patients, and others rely on NEMT companies to access medical care, rehabilitation, and community activities. When transportation fails, patients miss appointments, become isolated, suffer health setbacks, and in some cases are placed in immediate danger. The recent death of Mesa resident Lorenzo Lopez, a man with developmental disabilities who was reportedly found deceased inside a vehicle outside a care facility during extreme heat, highlights the potentially devastating consequences when vulnerable individuals are not properly monitored and protected. These are not unforeseeable events. They are predictable risks. The technology to reduce these risks already exists. GPS tracking, automated check-ins, real-time ride monitoring, emergency escalation procedures, location sharing, and smartphone SOS features are commonplace. Yet patients continue to be forgotten, stranded, and placed in dangerous situations. I believe this issue deserves closer examination. What safety standards are required of NEMT providers? How often are patients left waiting for hours? What accountability measures exist when transportation companies fail? Why are basic safeguards not standard practice throughout the industry? This issue affects thousands of Arizona families who often have no transportation alternative and no choice but to trust these companies with their safety. I would welcome the opportunity to share my experiences and discuss practical safety measures that could help prevent future tragedies. My call to action is simple. Healthcare providers, transportation companies, regulators, elected officials, patients, and families must come together to establish stronger safety standards, real-time accountability measures, and emergency response protocols for NEMT services. We should not wait for another patient to be stranded, injured, or lose their life before addressing a problem we already know exists. The warning signs are here. The technology exists. The solutions are available. The time to act is now.